research shows that Americans' mental health has taken a big hit during the pandemic. And while it's becoming more common to talk about mental health issues, there's still a stigma around it, and many people don't know when to ask for help.
Dr. Arthur Bregman is the former chief of psychiatry at Nicholas Children's Hospital. He runs his own practice now in Coral Gables and wants to get everyone more involved in dealing with mental health, their own and their loved ones. Dr. Bregman, thanks so much for joining us. So what's prompting you to do this now?
Oh, thank you for having me on today. Okay. Well, I've been practicing, for 40 years, and I just, want to give back. And really one of the things I see, especially in this troubled time, is really a need for increased awareness of especially suicide risks. I know it's not the greatest topic to talk about, but it's important. It has to do with depression. 2% of 60 million depressed people commit suicide. So this is a very, very significant issue. I think we need more awareness of it so people are more proactive.
Yeah, and just lately we've seen, people that you think are so successful, and we saw the former beauty queen that died by suicide, and you ask yourself, what is going on behind the scenes that we don't know? Are mental health problems getting more common, or are people just more willing, do you think, to come forward and be counted?
I think it's both. I think it is certainly more common, especially nowadays. That people are under tremendous stress. And there is greater awareness, through the social media, people are more comfortable, there's less stigma. So I think it's both.
You mentioned that people are under a lot of stress. What other factors are contributing to poor mental health?
Well, right now, especially at this time, and we saw this in the pandemic of the Spanish flu 100 years ago. There was a pandemic after the pandemic, and that's what we're having here now with mental health. I think what's happening here is that we need to become much more aware and proactive about helping people to listen to people around them. And I think when we talk about the highlighting of very famous people committing suicide recently, one of the things about it was that nobody knew, or they say they didn't know. And I think people need to be much more vigilant and ask a lot more questions, especially when they see their loved ones changing.
Well, talk about the difference between seeing a psychiatrist for medication, perhaps, and a therapist for counseling. How do you know which is the best option for you?
Okay, that's a great question. A lot of people are very confused about this. Basically, it's a difference in training. The psychiatrist was trained in medical school and has a residency in medical background. The psychologist is trained in graduate school and has a graduate training. Now, generally, the psychiatrist manages the treatment plan, and lots of times we refer to psychologists and we all work together. And that's really, the art of it now. The psychiatrist, more medical management and developing the treatment plan, and the psychologist referring to us as well, but also being involved in therapy along with med.
So let's say people have made that very important and brave decision to seek out help. Then they feel like they're faced with so many different options as to the provider that they should go to. How do you find a good therapist, being that it's such an intimate relationship?
That's a great question, okay? And I think it has to do with people's feelings. First of all, when talk to people, talk to your prospective therapist or psychiatrist on the phone, see if you could feel like you could trust them, feel like maybe they could understand you. That's really important, that the therapist, psychiatrist understands you, and you feel some trust and some feeling that you could confide in that person.
All right, Dr. Arthur Bregman, thank you so much for shedding some light on this very important topic affecting so many people out there. And as you said, there has been a stigma, and hopefully people can look beyond that, because there is help out there, and certainly people need it, given what we've been living through. Thank you very much.
Doctor, thank you.
Absolutely.